guys, this is Malinki. Welcome back to my channel, Voice of Malinki. Today we will talk about the genetic counseling. And if you are new in my channel, please subscribe my channel. And if you like my video, please do like, comment and share my video. So genetic counseling is basically a process that helps people and families understand and manage genetic disorders. So a particular family or a particular couple could be interested about the disease or disorder that is there in their family. So if it is genetic disease, or what would be the future effect. And suppose a couple of parents want to have a baby and they are planning for pregnancy, but they are skeptical about the outcome, whether the baby would have any genetic disease or not. So they may decide to visit a genetic counselor. So what are the aims of this counseling? First is risk assessment. Evaluate and quantify the risk of inherited conditions based on family and medical history. Suppose the grandfather had a syndrome, a genetic syndrome, then the couple may be interested to know whether the future generation will also have the probability to get that syndrome. Next is education. Provide accurate information about genetic disorders, inheritance patterns and potential health implications. Suppose a family wants to know about the Down syndrome, that is very common, right? So they may go to the genetic counselor, and the counselor will educate them about the disorder, what is the inheritance pattern of this disorder and its health implications. Next is informed decision making. So assist individuals and families in making informed choices regarding genetic testing, management and preventive measures. So the counselor will suggest that the probability of the genetic disorder that the future generation may have, so they will suggest that what is the probability and how can you take decision, how can you manage and how can you diagnose if it happens or not. Next is psychosocial support. So offer emotional support and coping strategies to help individuals manage the psychosocial impact of genetic risks and testing outcomes. So basically there are no any genetic risk if you want to diagnose, if you want to check whether you have the carrier gene or not. There is no any genetic risk. And but sometimes what happen, we are very much scared, we are skeptical to go to the genetic counselor, and they will actually support us that you can come, you can do it, and nothing big deal is there. Next is medical management. So develop personalized plans for monitoring, preventing or treating genetic conditions based on test results. So if the couple have suppose 75% chance to have a baby who will have the genetic disorder, at that time genetic counselor will help them to how to proceed, if it is okay to go with the plan or if it is not, and if the baby comes with the disorder, what will happen, how to handle. These are different situations. So genetic counselor will help the couple. Next, ethical considerations. It address ethical issues related to genetic information, including privacy, confidentiality and potential discrimination. So we are very much scared about these things, like society will isolate us, what relatives will tell us. So in that case the genetic counselor, he or she will help us to how to cope with this situation. So steps of genetic counseling. First is diagnosis. the disease should be correctly diagnosed. The genetic counselor should analyze the genetic background of patient and then assess the suspected disease that child can develop. So if there is possibility that the child can develop that disease, or if there is no such possibility, so they will first diagnose you. Next is prognosis. Prognosis means opinion. So genetic counselor will explain the couple about the chances of their child about developing a disease. Say it is the Down syndrome. So what is the probability? It's 25%, 50%, 70%, 100% or 0% that the child may have this disease or not. Okay. Next is treatment. Genetic counselor will provide a path of correct treatment process to the couple. They will show you the light of treatment, and then this is the importance of genetic counseling. So genetic counseling helps identify the risk of inherited conditions, allowing individuals to make informed decisions about their health and future. That if a person has a genetic disorder, he or she should be informed properly, diagnosed properly, and genetic counselor will say that how to proceed, what to eat, how to continue your life, blah blah blah. By understanding genetic risks, people can take proactive steps to prevent health issues. This can include lifestyle changes, early screening or preventative treatment. So these are also there. The patient can change his or her lifestyle, he or she can have healthy foods, and there are some preventative measurements, preventative treatments also. There are some drugs also he or she can take. Couples who are planning to have children can benefit from genetic counseling by understanding the likelihood of passing on genetic conditions to their offspring, like thalassemia. So if there is any probability that the child may have that disease, and what is the probability, so what to do now. Next is genetic counselors provide emotional support to the patient. They will always support you emotionally, and genetic counseling is important for those with a family history of genetic conditions and expectant parents concerned about the health of their unborn child. So the family who has the history of genetic disease will be more probable to get the disease. The future generation will have more chance to have the disease. Okay, so this is all about today's lecture. I hope you liked the lecture. Thank you for watching my video.